am Naira Ingram, and I'm a patient of the Virginia Eye Institute. I have a condition called macular degeneration, and Dr. Ladd's treating me for that.
Macular degeneration, which is the leading cause of blindness in patients over the age of 40. It affects about 1.75 million Americans, and there's about 200,000 new cases diagnosed each year.
I have a 4C machine. It's a small machine that I have at home that I look in at least once a day.
The 4C home device provides you added security between visits that your vision is being monitored on a daily basis. The device is a standalone piece of equipment which will sit on a desktop or tabletop, and we recommend that you use the device daily. The device will flash a line across your vision with a bump in it, and you use the mouse to click where you see that bump. The test usually takes about 3 minutes per eye. But the beauty is that that information is then directly sent to the home monitoring center, which is comparing that to your baseline. And if they detect a trend where there's a new area of distortion in your vision, they notify us that you need to get in sooner, and usually within a week, to have that evaluated for early transition to the wet type of macular degeneration.
There's no cure for macular degeneration. So he explained to me that the next 4 to 5 years will be crucial. But with the machine, we're hoping to stay on top of it. The right eye, there was a change, not for the better, for the worse. And they picked up on that right away. They called me and got me in either that day or the next day to start treatment.
The good news is we do have good treatments for the more severe forms of macular degeneration, at least the wet type, which refers to the abnormal blood vessel which can grow underneath the retina. And so detecting these changes early is helpful, because once we start treatment, studies show that 95% of the time we can keep your vision stable. And 40% of the time there'll actually be improvement in vision. And so that's why it's important to get diagnosed and treated early.
They give you a shot in the eye, which sounds really bad, but it isn't. They put a little drop in your eye that numbs it first, and then the needle is very, very small gauge needle, and it's done so quick that you hardly even know it. So it is not painful.
The Virginia Eye Institute believes in bringing the latest technology to our patients to provide the best eye care and preserve as much vision as possible, which is why we're excited to partner with Notel Vision and bring the 4C home device to our patients so that they are getting the cutting-edge technology of home monitoring and the ability to preserve as much vision and detect that visual change as early as possible.